up front, and that's why we feel pretty confident that over the long term, as a consequence of the Affordable Care Act, premiums are going to be lower than they would be otherwise. Healthcare costs overall are going to be lower than they would be otherwise, and that means, by the way, that the deficit is going to be lower than it would be otherwise. Understand, I want to make sure everybody's clear. The Congressional Budget Office, which is independent, it's historically bipartisan, this is sort of the scorekeeper in Washington about what things cost, says that as a consequence of this act, the deficit is going to be over $1 trillion lower over the course of the next 2 decades than it would be if this wasn't passed. And the reason this is so important is because right now there's a political debate going on about should we maybe repeal the Health Care Act, or, because this is part of big government. And you've heard, the Republican leader in the House saying that's going to be one of our priorities, chipping away at the Health Care Act. Well, first of all, I want to see them come and talk to Gail or talk to Dawn, or talk to any of you who now have more security as a consequence of this act, and I want them to look you in the eye and say, sorry, Gail, you can't buy health insurance. Or, sorry, little Wes, he's going to be excluded when it comes to an eye operation that he might have to get in the future. I don't think that's what this country stands for. But what they're also going to have to explain is why would you want to repeal something that Congressional Budget Office says is going to save us $1 trillion if you're serious about the deficit? It doesn't make sense. I mean, it makes sense in terms of politics. It doesn't, and polls. It doesn't make sense in terms of actually making people's lives better. Okay. Anybody else? Yeah, go ahead. Kathleen's got a mic.
Thank you. Yeah, I want to thank you. First of all, I have a son with intractable seizures, and this bill is going to make a huge difference in our lives personally. But I also want to speak on behalf of small business, because small business has been used as an argument against this bill, and I find it very hard to understand. I think there's a huge campaign of misinformation. In fact, we were about ready to make a choice between not insuring our employees anymore because we simply couldn't afford it. It was $90,000 a year and a third of our payroll, or close our doors because, we had no choice anymore. And this bill and the tax increment that I get back takes that statistic from 30 to about 18%. It makes it a massive difference in the fate of our business and in the fate of all of our employees who are insured. We did not want to drop our policy, and in the fate of our son. And I guess my question is, what can we do about this misinformation? It seems so pervasive everywhere, and it's so wrong. I think this bill is really affordable for small business, and I want some way to get that word out.
Well, I appreciate that. Tell me what kind of business you got.
I own a bookstore, the King's English.
Oh, do you?
Yeah, in Utah.
Well, that's wonderful.
Thank you.
I love bookstores.
I know you do. I follow your career as you go from one to another.
I used to be able to roam around in bookstores. Now it's a little more noticeable when I go in there. But
we read about it.
And so you've been providing health insurance to your employees, but what you were seeing was because you're not Xerox or General Motors, you don't have this big pool, so you're essentially in the small pool insurance market, and like the individual market, you were seeing your premiums just going up and up and up. What was happening to them over the last several years?
Well, in 2008, 3 of us hit 60, and of course that's a place where they really go up, and our premiums shot up to well over 30% of our payroll, which shot our payroll up to 30% of our growth, which is totally unsustainable.
That's basically your margin.
That's it. Way more than that.
Way more. Right. I mean, it eats up whatever profits that you're making. Yes. So, as a consequence of the Affordable Care Act, we've got 4 million businesses like yours that are now eligible for significant tax reductions that'll pay for up to a third of the premiums that you're paying for yourselves and your employees. I mean, that goes directly to a small business's bottom line. Now, what you'll hear is, well, but some businesses, they're now mandated to provide insurance, and if I have to provide insurance, then I'm going to I'll hire fewer people. But it turns out that actually, and Kathleen will correct me if I'm wrong on the statistics here, it turns out that because employers with 50 employees or less are not subject to any penalty for not providing health insurance, about 96% of small businesses, they don't have any requirement on them, but they can take advantage of it. Now, it is true that if you've got a business that has 1,000 employees, you're not providing them any insurance whatsoever. What we're saying is, you know what, that's not fair, because all the rest of us are going to be paying for those folks when they go to the emergency room or they apply for Medicaid or what have you. And so we're going to say, look, if you provide insurance, we'll provide you help. If you don't, then we're going to charge you for the fact that somebody else is going to have to cover those costs. But for the vast majority of small businesses, this is a great deal. And we've got testimony here to show it. Now, in terms of how to get the word out, nobody's more effective than you, so I hope that all the reporters who are here will record what you just said, and will help get that word out. But it's a challenge, because frankly, there was opposition from the Chamber of Commerce and some other small and some other large lobbying organizations in Washington that said they were speaking for small businesses, but when you looked at the facts, this was good for small businesses. In fact, probably nobody benefited more, because nobody's getting hurt more by health care costs than small business. So thanks for sharing your story.
Thank you.
Anyone else? I know it's warm out here, but I want to hear from as many people as I can. Go ahead.
Hi. Thank you so much, Mr. President, for having us here. I want to thank you. I just have a comment. My son, Sammy, who was here, is 7, and he has neurofibromatosis. I don't know. Have you ever heard of it?
I've heard of it, but you should describe for us what that means.
It means that he had a spontaneous mutation on his chromosome, and he was diagnosed 2.5 years ago, and it just basically means your tumor suppressor doesn't work properly. So every nerve cell has a potential of becoming a tumor. So there's
Which
a wide,
is pretty nerve-wracking for mom.
It's unbelievable. And there's a wide spectrum. So some people end up with minor complications, but others have serious problems. And he's already had surgeries and things of that nature. So I just want to thank you and the Secretary and Congressmen and Senators, because it's life-changing for a parent.
Well, Sammy looks terrific. Saw him running around
He is
here.
terrific.
And
Yeah.
and I'm just glad to give you peace of mind. Look, people ask me sort of, how do I stay calm in my job? The reason I stay calm in my job is that every night at 6:30, no matter how busy I am, I go upstairs. I've got a very short commute. And I go upstairs and I have dinner with my wife and my daughters. And as long as they're doing good, as long as they're healthy and happy and running around and telling me stories about the crazy things that happened at school today, then there's a certain baseline that just gives you that sense, well, I can take anything, right? Now, the flip side is when Malia or Sasha get a sniffle or an ear infection or a scrape or a bruise, I'm over there just miserable. And I still remember Sasha when she was 3 months old. One night, she just wasn't crying right. As a parent, you start recognizing it. That's not how she cries. She wasn't hungry. It wasn't a diaper change. Something was going on. So we called our pediatrician, and he said, well, why don't you bring her down? And this is in the middle of the night. This is like 1 o'clock in the morning. And he was willing to see her, and he pressed on top of her head, and he said, she may have meningitis. I want you to go to the emergency room. And it turned out she had meningitis, and she had to get a spinal tap, and they had to, keep her there for 3 or 4 days. And the doctor was talking about if this didn't, her temperature didn't come down, and if we didn't solve this, she could have permanent damage to her hearing and or other effects. But I still remember that feeling of just desperation, watching the nurse, take her away to provide treatment for her. But I was thinking, what if I hadn't had insurance? I mean, what if I was looking at my bank account and I didn't have the money to cover her? How would I be able to face my wife, and how would I be able to look in the mirror if I didn't feel like I could somehow make sure they were okay? And that's what this is about, ultimately. I mean, we've got to make sure that healthcare, our healthcare dollars are used smartly. We've got to make the system work better for consumers. We've got to make it more responsive. But ultimately, the thing that's most important is we've just got to give people some basic peace of mind. And I'm just so glad that I'm able to stand here before you and hear these stories, and hopefully it gives you a little more peace of mind. So, all right. Well, thank you, everybody. Appreciate you. And if anybody else has any questions, they can come up and we can chat in the shade here. Because I don't have to go right away, and maybe these guys will take some pictures. So, thank you. Thank you. Thank you so much. Tell them they need to watch more baseball. When you're down to 300, that's good. When you're down to 800, 700, that's pretty close. That's what we need. Thank you. Thank you so much. Thank you so much. Thank you so much. How old are you? Oh, that's good. Well, you guys are still in the diaper phase, We're so grateful you're doing it. Right. That's a lot of work. How'd you know?
You had that look about you.
Thank you, man. Oh, this must be Sammy. That's a big rock. It's a meteor. I think you might be. It's a couple of meteors. It's an asteroid. So this is the asteroid. This is